This is going to be Chapter 12, Medical Terminology. And after completion of this chapter, you should understand the origins of medical terminology, how prefixes and suffixes complement a word's meaning, the importance of standard abbreviations, using topographic anatomy to accurately describe the body's position and direction. And very quickly, we're going to talk about medical terminology. And first, the medical terminology may be difficult to learn and pronounce. May even be considered like a second language. It's pretty much the medicalese, if you will, language of medicine. Understanding a few rules will help a paramedic become fluent in medicalese. The root words come from Greek and Latin, and in the past, they were pretty much common to men of science. Medicine started to develop an extensive vocabulary, and this continues even today as a means of communication. The anatomy of terminology. Most medical terms consist of 4 parts. They consist of a root word, a prefix, a suffix. The root word relates the main idea. An example of this would be cardia, which means heart. A prefix builds on the root word. Examples of this would be neo. Example in medical terminology, neoplasm. Microscope would be the other one, micro meaning small. And a suffix complements the root word placed after the root and changes the terms or meaning. Example, a suffix of cardio would be megaly. So instead of just the heart, it would be cardiomegaly would be an enlarged heart. So these are some common root words used in EMS. Adeno, meaning gland. Adenopathy would be diseased gland. Cardio, cerebrum. Enero, intestines. Erythro, red. Gastro, stomach, and so on. Reno, kidneys. Trachea, and so on. This is table 12.1. I would suggest that you look over these and become very familiar with them. This is a partial list of medical prefixes. A, like apnea, would mean without breathing. Ab, from or away. This would be a prefix before the root word. Dextro, right side. So an example of this using dextro, dextrocardia, which would mean heart on the right instead of the left. It kind of means that things are in reverse. Hypo, beneath or low. So hypoglycemia would be low blood sugar. So prefixes of color, chloro, green, cyan, blue, erythro, red, leuc, white, melon, black, black tarry stools, melena. Prefixes of position, add mean toward. Dorso would mean the back. Dorsiflexion, example of this. Ladder, side, lateral. Endo, inside. Exo, outside. An endocrine organ would be inside the body. An exocrine organ would be outside the body. Prefixes of numbers. Aniso, unequal. Diplo, double. Hyper, above. Hypo, below. Iso, equal. Mega, large. Micro, small. Partial list of common suffixes for diagnosis. Algia, neuralgia would be a word applied to this. Neuro meaning nerve and algia meaning pain, nerve pain. Emia is another one. Let's use it. Anemia, without blood. A meaning without. Ectasis, expansion. Bronchioectasis, enlarged bronchi. Aphasia, which would mean speechless. So please look over these. This is table 12.6 in your book as well. Diagnostic suffixes for medical instruments. A gram, an electrocardiogram, would be an example of this. An electric heart record. Recording to electrocardiograph. An electric heart recording tool. So, needle on the paper, marking out everything. Meter, measured tool, capnometer. Scope, laryngoscope. Medical suffixes, iac, hemophiliac, afflicted, blood afflicted, unhealthy, aya, anesthesia, ism, alcoholism, ist, cardiologist. Combining forms and plural forms. Sometimes two root word terms are used. Combining vowels must be used as well. Unnecessary if the root word ends with a vowel. Plural forms, there's only a few rules with this, and this is the next slide that we'll show here. An example of this is examples of combining terms. Ist, which is specialist. Cardiology means the study of the heart. Ist would be a specialist. So a specialist in the study of the heart, cardiologist. Otomy would mean hole. Trachea, tracheotomy would mean a hole in the trachea. Singular forms, if it's in the verbiage of a, the plural form of it would be add an e. In another way, a singular form, if it ends in y, drop the y and add ies. So a few rules there as you come across these. Just take a good look at them. Reading medical terminology. When both a suffix and a prefix are used, the suffix is read first, then the prefix, then the root. And this is kind of difficult for people that normally read left or right. It's difficult for them to take a look at the suffix, which is generally at the end, and then look at the prefix, which is in the front, and then look in the middle. So we're just combining words, dissecting and articulating them together so that we understand them. Each one of those little words has a specific meaning. Pronunciation, the key to understanding, dissection and articulation. Others may correct. Medical professionals will help you correct errors if you have them. Repeating the correct pronunciation will help you commit it to memory. Spelling and abbreviations. Many medical terms have similar surrounding constituents but are spelled differently. Avoid errors by spelling correctly. Spelling them correctly can be difficult, especially if the paramedic hears the word spoken and then must spell it. To avoid errors and confusion, the term should be spelled correctly. When in doubt, consult a medical dictionary. Abbreviations. Basis is brevity. Short and concise is what I mean by that. Due to errors, many are no longer accepted with this because they can easily be mistaken for something else. Refer to table 1212 in your book on this. Many EMS agencies have only an accepted list of abbreviations, but whenever you're writing abbreviations, you're trying to shorten your verbiage so that your information is concise. Topographic anatomy. Position and directional terms. Directs to the body area of an organ. 3 body planes. There's frontal, sagittal, and transverse. Assumes the patient is in the anatomical position. And I got some of the tables here to kind of talk through. Example, caudal, which is on the transverse plane, and it's inferior, it means towards the feet. A cephalic, transverse plane as well, superior towards the head. These are directional terms, 1213. 1214, relational terms. Apex, which would be the top of the pyramid. An apex or an apical pulse is the top of the pyramid on the heart. A base, bottom of the pyramid, which in the heart's case is up towards the top. Distal, away from the structure. Lateral, to the side. Medial, towards the structure, towards the middle. Deep, away from the surface. Superficial, towards the surface. Terms describing patient positions, we use these quite commonly. Prone, supine, left lateral, Fowler's, Trendelenburg's, Sims. Terms describing movement: adduction and abduction. Abduction, away from the midline. Adduction, towards the midline. Dorsiflexion, backwards. Eversion, turn outward. Extension, straighten. Flexion, bending. Supination, turn upward. Conclusion. Abbreviations in medical terminology, when used inappropriately, only serve to confuse the message. With practice and attention to detail, the paramedic can learn medicalese and become conservant with healthcare professionals. References were taken from Professional Paramedic, Volume 1, Foundations of Paramedic Care, First Edition. And if you have any questions concerning this chapter, feel free to contact me. My name is Roy Smith, smithr@imsa.net, or 405-219-7613. Thank you.